We can't know the best way to treat a problem until we fully understand what the problem is. So what is a cruciate ligament problem? We'll set the scene by looking at a human knee. The abbreviation ACL stands for anterior cruciate ligament. ACL injuries in people are caused by overload, typically by twisting a knee when playing sport. Now there are two important things to remember about human ACL injuries. One, before the injury, the ACL was normal. And two, in a person, the surface at the top of our shin, which is called the tibial plateau, is flat. So with these two facts in mind, let's switch to dogs, who in this case are not furry humans. A dog has the same ligaments in their knees as we have in ours. You might hear us say CCL instead of ACL, but that's just a different name for the same ligament. The first critical difference between dog knees and human knees is that most dogs who injure an ACL didn't have a normal ligament before the injury occurred. It was already weak. And if you want to know why it was weak, your answer's just up there. The second key difference between dogs and people concerns the shape of their knees. A minute ago I told you that our knees have a flat tibial plateau, and I also said that this was important. Now the reason it's important is that the flat surface makes our knees inherently stable. If you or I ruptured an ACL, we'd have a high chance of a good outcome without needing surgery. But our dogs don't have flat tibial plateaus. Theirs slope backwards, usually by about 25 to 30 degrees. And this slope becomes important if an ACL frays or tears. In dogs, any damaged ACL, even one with a minor injury, must fight against a mechanical compromise that people don't have. And on the subject of mechanical compromise, our next topic is knee arthritis. In people, knee arthritis is common. In fact, it's so common that most of us have a friend or relative living with chronic knee pain. In some people, knee arthritis creeps up gradually. For them, it's the sum of decades of wear and tear. And we know that knee trauma has a high chance of accelerating wear and tear. This is why people who need knee surgery early in life sometimes need knee replacement later in life. Dogs are a little different. Provided we stabilise their knees, dogs with ACL injuries rarely suffer from knee arthritis. But that doesn't mean they don't get knee arthritis. While people are prone to diffuse cartilage wear, dogs with ACL injuries are prone to a focal cartilage injury called a meniscal tear. When we look at a cross-section through a dog's knee, we see a pair of shock absorbers. Each of these crescent-shaped cartilages is called a meniscus. They come as a pair, and together they're called menisci. Now the back half of these menisci sit at the lowest point of the tibial plateau. That's the bottom of the hill. So in an unstable knee, the back of the menisci gets squashed, and a squashed meniscus often becomes a torn meniscus. Now this isn't a freak injury. It's common and it's painful. But the good news is it's treatable. And if you'd like to learn how, the answer is just over there.